Hi everybody. In Japan, there has been a lot of discussions going on about the public health aspects of COVID-19 and whether to test people or not. And some people argue that from public health point of view, it is not such a good idea to test so many patients because one, the resources of medical facilities would be exhausted, and two, the very process of testing might expose people to the virus and spread the disease and so on. So this kind of public health argument can take various forms, and it's different from nation to nation. And the Japan's policy has been criticized by other nations, and there are criticisms in Japan too. But there's this ongoing argument about public health policies, which policies would be best to tackle this problem. And for example, the lockdown is apparently good in terms of containing the virus, but on the other hand, lockdown can lead to really serious social economic problems. So that some people argue, especially in Japan, that a total lockdown is not a sensible idea. We should keep the economy going while trying to suppress the spread of the virus. So this public health and socio-economical argument about what is the optimum strategy to take goes on, and there would be some evaluation functions that can be defined in this context. However, having said that, I think there is this question of individuality, the happiness and welfare of individual person. Because if you take a public health perspective, then the optimization can occur only at the systems level. So how to reduce the number of deaths, how to minimize the number of severely affected patients, and how to best allocate the medical resources to cure people. These are the public health arguments. But that can sometimes run against the happiness of individual person. For example, this triage argument when you say that, oh, maybe we should assign the ventilator to younger people because elder people do not have a better chance of survival, so we should really allocate the ventilators to young people. This kind of argument is often done in the context of public health, but that is a terrible news for an individual person. For example, for somebody who have elder parents in their 80s, these are their dads and moms, and so if you say that, oh, from public health perspective, people more than 80 years old, they don't have significant chance of survival, so maybe we should allocate this ventilator to this 20 years old patient who actually does not show a severe symptom as your dad, but we're trying to use the ventilator to this younger person anyway because he would have a better chance of survival. This would make sense from public health perspective, but it's such a devilish, bad argument from the point of view of individual welfare. So there's this dichotomy, this really contrasting, almost incompatible views of the public health perspective, which is a systematic view, and the view of individual freedom and welfare. So this has been going on. This argument has been going on theoretically for many years now, but in this COVID-19 outbreak, we are facing this problem really in a hard way, and probably we were not prepared. And in Japan, this argument is also going on, and I suspect that this argument is going on everywhere in the world, and this actually is very much related to how to design self-driving automobile, because in the self-driving automobile, The question is how to evaluate the potential risks and benefits of a certain maneuver, like when a child runs into the front of the car, and should the car stop abruptly, thereby endangering the passengers on the vehicle, or should it just keep going and try to avoid the child while keeping the safety of the passengers? This is a really tough problem, and this is also a dichotomy between systematic optimization and the welfare of individual people concerned. So we are entering an era where this kind of argument can be done explicitly. Of course, throughout the history of our species, this has been a constant situation. This constant constraint on our behaviors and thinking. This dichotomy between systematic optimization and individual freedom and welfare. But this has been becoming really acute and present problem in the last few weeks, and we should really be aware of that.